Hi all, my name is Rachel Messer and this is my brachial plexus presentation, and I made a cross stitch as my representation for you all today that I'll be using. So to start off, we have the origin of the brachial plexus is at the spinal cord starting at the neck, and it spans from C5 to the T1 vertebra. And then we have 5 sections of the brachial plexus. We have the roots, trunks, divisions, cords, and branches. One way to remember this is Robert Taylor drinks cold beer. So the C5 and C6 roots form the upper trunk. C7 has the middle trunk. C8 and T1 roots join together to form the lower trunk. From these 3 trunks, we have 2 divisions. So the dark green is the anterior, the light green is the posterior division. From these 2 divisions, we have 3 cords. So we have the lateral, posterior, and medial cords. From these 3 cords, we have 5 main nerves. We have the musculocutaneous nerve, axillary nerve, radial nerve, median nerve, and ulnar nerve. And these 5 main nerves innervate the shoulder, elbow, wrist, and hand, and fingers, which makes up the whole upper extremity. You also may notice that we have little branches off of the different sections of the brachial plexus. So at C5, at the roots, we have the dorsal scapular nerve, and we have the contribution to the phrenic nerve. And at the trunk, we have, or the upper trunk, we have the suprascapular nerve and the nerve to the subclavius. At the cords, we have the lateral pectoral nerve on the lateral cord. We have 3 on the posterior cord. We have the lower subscapular nerve, thoracodorsal nerve, and the upper subscapular nerve. And at the medial cord, we have the medial pectoral cord nerve, and we also have the medial brachial cutaneous nerve and the medial antebrachial cutaneous nerve. So the brachial plexus is important to understand because as OTs, it's incredibly complex to diagnose and to recognize in patients, but it's also very time sensitive as we are treating nerves, and they can be very, or it takes them a long time to regenerate, but we don't want to lose muscle, or we don't want to cause muscle weakness, or we don't want to lose muscle strength while the nerve is regenerating. So some symptoms of the brachial plexus, of a brachial plexus injury may be pain, loss of sensation, muscle weakness, and paralysis of one or all of the muscles of the shoulder and the upper limb. And I actually had experience with working with a patient with a radial nerve injury. So he had radial nerve palsy from, he had his arm over a chair and he fell asleep that way. And due to the compression of the corner of like a wooden chair, in his, compressing the radial nerve in his armpit, it caused a lack of wrist extension when he woke up. So when he woke up, he wasn't able to extend his wrist due to that compression of the radial nerve over a long period of time. And also another way that we can recognize this radial nerve palsy in patients is patients with crutches. So a patient with crutches, that constant pressure and compression of the radial nerve at the armpit can cause this loss of extension in the wrist or thumb or fingers, and can also cause like numbness and tingling within the fingers as well. And some of the OT interventions that took place were electrical stimulation, so to try to get the muscle to fire again and those nerves to fire again. They simulated that muscle contraction with the electricity, and also just some light wrist strengthening in extension with help from the other hand to just to keep the muscle from weakening over time as the nerve was regenerating. So overall, it's important to understand the brachial plexus so we can help patients recover from injury, and also just understand it for ourselves so we can recognize it in later practice. Thank you.